I'm so sorry for whatever happened right now. My name is Daleep Manhas, and I'm part of a new startup called HealthPresso. Uh, so, what we are trying to do with HealthPresso is that this is a platform that can be used by individual doctors, it can be used by hospitals, it can be used by healthcare brands, and it can also be used by agencies that are normally working with hospitals or with individual doctors. So here what we see is that there is a doctor who is standing and he's saying, hey, I want to share my knowledge with more people, but how? And that's a confusion that a lot of doctors have. And then he's thinking that camps and CMEs are effective but time consuming, and regulations are making traditional advertising impossible. Moreover, these methods just reach a few, because how many will I do? How many doctors will I or patients will I reach individually? I do patient education camps, I do other things. How do I sort of increase my reach? How do I take my story to more number of people? And he starts thinking that there must be a better way. And that's when his colleague walks in and he says, hey, Ram, have you heard of HealthPresso? It's a game changer for doctors like us. And this is just one case study that we are showing over here, which could be a doctor, but it could be applied to a healthcare brand, a pharmaceutical brand. It could be a hospital kind of a setting that's struggling with these kind of things. So he says that this is a platform that I have seen and it could be a game changer. And then he says that with HealthPresso's deep tech engine like Humata, you can create press releases, distribute them to media outlets, and amplify your messages on social media all in one place. And Dr. Ram says, wow, this is so user friendly. And then he gets on to the work. He says, this could be the solution I have always been looking for. And he opens the platform and on his computer enters a 50-word brief of his story. Now, his story could be anything. He has done a complicated surgery. He wants to send out a message on diabetes education during Diabetes Day, or it could be an original research he has done with his colleagues. He can just enter anything. And crafting my press release on HealthPresso is easier than I thought. Now to share them with the world. And he presses the button, and the press release starts flying out of his screen. And people of all ages from different locations read this article online, maybe on newspapers, and they also view the video that he has uploaded. And people from far and wide are coming to know of my practice. Thanks to HealthPresso's seamless media distribution, his messages are reaching audiences far and wide. And now suddenly we see that someone from HealthPresso appears next to him, and he says, hey doctor, let me amplify your messages further. So Dr. Sriram is now beaming with confidence as his audiences are seeing the messages on social media handles also. So what the HealthPresso executive has done, he has adapted the same press article into different medias like Facebook, Instagram, X, or LinkedIn, on maybe WhatsApp, on blog, and other things. Yes, with HealthPresso, I can make a real difference. And then we see he is surrounded by diverse audience. No longer confined by his location, Dr. Sriram becomes a beacon of knowledge, online and offline, guiding and educating countless individuals on matters of health. So that's what HealthPresso is. We are calling it creating health connectors, because that is what we are enabling doctors to become, like health connectors. They'll be able to reach out to their health consumers, which they are not able to do today. So armed with only his passion and powerful platform like HealthPresso, Dr. Sriram Lakshman embarks on a journey of enlightenment, spreading his POV to every corner of the country. So that is what we are trying to create here. It's an content ecosystem we are creating, completely automated, driven by AI. And I'm happy to say that right now, content creation is completely free on our platform. Anyone, even someone from you, if you have doctors, if you have hospitals, they can just come to this platform, create their account, and start creating their press release completely free of cost. Of course, the distribution of that press release is something that is chargeable, but content creation is completely free. We have our own AI health trained engine, which identifies that this is a health topic, which looks at all the very, very reputed references and get information only from there. We have a very small demo. If we have some time, maybe we can show it to you. If we don't have, maybe we can talk later about it. So this is what we are trying to do. This is the vision we have, that within next 5 years, we'll want to reach out to more than 1 million users who will be using our platform. This platform has global applications. We are already in advanced stages of our discussions in the UK and US markets for this platform. This is what we want to do. We want more and more health consumers to be aware of these conditions and what's the best way to tackle them. I will just very briefly take you through this. You are a health provider. You come to our platform. You enter a 30 to 50 to 100 word brief of something you have done. Maybe I have done a gallbladder surgery and removed 300 gallstones without touching the gallbladder. And that's something that I want to talk about, what I did. I enter that brief. My content engine will work on it. It will create a 300 to 500 word press release. It goes through news wires and it is distributed to around 300 media outlets. And if the story is really worthy of it, we have seen that it can even go on newspaper. A lot of medias pick it up first on their online and then on their offline platforms as well. And then once you are done with that, there is a real-time analytics dashboard that is available to all the users, where they can see where their news went and how it was published on different kind of medias. I will skip this part. Let me see. So this is the team that we have. That's Dr. Swadeep. He's the founder and managing partner. That's me. We have a tech team that sits out of Canada and they are developing it. We have Siddhant here. We have few very senior people from the media universe who are working with us. Some of these guys you must have seen on TV as well. Mr. Kishore Malviya was associated with Z News for a very, very long time. So that's the team that's working right now. Of course, there are more people who are there. That's us, HealthPresso. That's the platform HealthPresso. If we can play the demo part of it, is it possible to do that? It will just take 1 minute. I just want to give you an idea of what it looks like. Siddhant will do that. As we always used to say, that to err is human, but to really screw things, you need technology. So that's what is happening here. Not too sure if I'll be able to explain the platform without showing it on the screen. Sure. Yep. I think I can hear you.
So I'm assuming that there are three components to your platform. One is a content generation, the other one is a distribution, and the third one is a reporting. So the second and the third part is more or less very clear. Okay, you will distribute it and you will report it. The first part, how is it better than a generative applications that are already available? Point number one. And point number two, do you also have a physical moderation or a service which can probably enhance the content and make it more contextual than what your engine or the engines that are available outside, like your chat GPT, can possibly do?
Thanks. I was expecting this question. So there are two parts to this. One, of course, it's very, very specific to healthcare. Our prompt engineering, the tech team that is working on it, is doing the prompt engineering only on healthcare. We ourselves is a PR agency. If you know Dr. Swadeep, he's a legend in PR industry. We have done maybe, if I'm not wrong, maybe 2,000 to 3,000 press releases in healthcare in last maybe 3 to 5 years. So we have used all that data that is available with us to train. So we are training on all the healthcare data. That's why I was keen to show it to you. It's one news that we did, and there are a lot of things that are happening on the platform. I'll just give you one idea. So this Poonam Pandey controversy. So we use that as a prompt in our engine or in our platform, and we asked it to create it related to cervical cancer awareness. Now, when you see the kind of article it is created, it has taken references from WHO. It has taken references from American ASCO. So everything, all the references, all the data points, how it needs to be written, how it needs to be decoded. Everything is from a healthcare point of view. So that was, I think, the first question. Second question was, sorry. Yeah. So what we are doing actually right now, as I'm talking, we are creating our own AI. It might take 1 year more, but we are creating our own healthcare AI, which will be very, very. Is that happening? Yeah. So that will be available. So everything is related to healthcare, and therefore the kind of output that we are able to give is very, very specific to what the requirements of healthcare industry are, because we know you can't have a brand name, you can't have a very specific company name. So all those things are being trained, and then when on the platform, we also give doctors an option to choose the tonality, the tone, manner, context, language, how they want to do it. Everything is available to them.
So we've named our AI engine as Humeta, human and meta. And the main USPs include SEO optimized content creation through a deep tech technology, then end-to-end automated campaign management, real-time integrated performance dashboard, which helps you to save time and effort by creating high-value content in 2 to 3 minutes. Maximize reach and impact by establishing yourself as a thought leader in the field. Cost-effective solution as compared to the traditional methods, and staying ahead of the curve with the help of data-driven insights to build your practice.
Any more questions? Yeah.
There is no medical proofs. Some of the scientific data, they'll copy from some of the other. How your team is validating such a data? Whether they are going through a scientific community or a special scientist, so that they can recheck those data before you publish it.
Sure. Thanks. It's a very nice question. So yes, right now there is a physical aspect to the whole thing that's happening. Our content team is vetting all the data. So just to give you a flow of how we are doing it right now. So you as a doctor, you will come, you will enter your brief. It could be 30 to 50 words. You will say, okay, World Diabetes Day is coming. I want to talk about diabetes and complications. It will create, AI engine will create the first set along with all the data points that you needed or whatever things you want. Then our content team vets all the data. It goes to doctor as a public link. He needs to approve that data or his article, because at the end of the day, it is going by his name or whatever way it is going. And then it comes back to our team. Our team again vets it. And once it is finalized, then only it goes. And again, I'm saying we are doing health PR for almost so Deep has been doing it for last 20 years. And we had never faced an issue wherein we have quoted a wrong source. So that's the same team that's working at the back end. And we are training our AI also to become as smart as that. It will not become as smart as we as Homo sapiens are, but AI will try to be there. Any more questions? Sorry. Any more questions? This is not happening. Okay. So, I'm so sorry we are not able to do that right now. We would have loved to show our platform, but there's some technical issue because of which we are not able to do that. Thank you. Thanks a lot.
Thank you.